are happy to receive another house call from our friends at Astria. And this morning we're going to be talking with Kimberly Sales. She is a FNP, which that means financial news no, it doesn't mean that. That means she specializes in family nurse practitioner. That means she's the person that you're going to see with your family, and they'll give you the once-over. You can ask your questions, all of that, and then if you need something particularly beyond all of that, she knows all the right people. But Kimberly, welcome. Thanks for you coming in today. Appreciate you.
Good morning.
So most of the people from Astria who come here, generally speaking, are, I would say, highly educated, highly dedicated, highly motivated, and petrified of the radio. How many of those align with you?
I don't think most of those align with me. I'm not petrified of being on the radio. I talk a lot, and so that sometimes gets me in trouble. So
consider me one of your patients.
Okay.
That I'm in for maybe, I don't know, a psych eval or something like that, and so we'll go from there. Let's talk about family nurse practitioners. That puts you in the category of primary care, right? What is it exactly that a family nurse practitioner would do?
Family nurse practitioners and nurse practitioners in general have been around since about 1965.
What's the differentiation between just NP and FNP?
The NP part is the specialty is just being a nurse practitioner, but the family part means that I practice family medicine. So I see patients from, I say 0 up until, I think the oldest patient I've had so far has been about 96 years old. So I see patients across the lifespan. From birth until... And
other nurse practitioners might work with a specialist kind of thing or whatever, but
some of them do like gastroenterology and only do GI, some do dermatology and only do skin, some do cardiology. So you have to know
more than all of them combined, don't you?
Well, I like to say that a little knowledge is the best. And so I have a little bit of knowledge about everything, and what I don't know, I have good friends that I can depend on and great resources to help make the best care for the patient.
Well, your particular specialty really expands the opportunity for people to have a basic primary care provider, right? I mean, you add to the ranks of, like, I'm a general practicing doctor. Well, okay, you're a general practicing nurse practitioner, which puts you right alongside them, seeing the same things and doing all of the same stuff, really, right? Yeah.
And it's so important for people to have a primary care provider, because I like to think of it as being the quarterback of your health care.
Sure.
So that we help you get the care that you need.
Should I be concerned? The last two I walked into said, they took one look at me and they said, nah, we're not working with you. And then they sent me away. What does that mean?
I don't know.
What did they anticipate with me? Well, they weren't Astria, so it wasn't Astria. So I guess we'll just write that off as, I don't know. I'm just being silly. But you say from 0, so you see...
I see babies. I love to see babies. The youngest baby I've seen was 36 hours old.
Oh, wow.
So, fresh out of the hospital.
You look like someone that would be good with babies.
Well, honestly, when I went into nursing, I was doing only adult medicine and nursing.
Yeah.
And when I became a nurse practitioner, I decided to be a family nurse practitioner because I thought it would be more marketable at the time.
Sure.
But I had very little pediatric experience. But I've gained that experience over the years, and I love working with children. I really do, of all ages.
You just look like somebody that would love to give a kid a hug. I mean, that's how you look. I'm sorry, but you do.
Well, I give everybody a hug. How about that?
That's possible, but I mean, there's just something. You know this. I read people pretty well. I get a fix on whoever comes in here, and I can just see you in that role, and that is a comforting thing for the kids, your kind of approach, your gentleness, and it's a reassuring thing for parents. So obviously that's a vibe that you want to have, and I'm sure it serves you well. Like if I've got teenagers, what kind of things? I do have a teenager, as a matter of fact. What are the typical kinds of things that teens come in for? that you provide services?
I think the primary thing that teens are coming in for these days, having to deal with or do with well child exams so they can do their sports and things like that. Mm-hmm. So we do a lot of assessment about all the things that they're doing so that they can make sure that they're having a healthy life. So making sure that they're not getting too much screen time, making sure they're getting exercise, making sure they're eating properly, making sure that they know that smoking and drugs are not good for them, making sure that their environments around them are safe, that there's no one who's bullying them or any of those kinds of things. So we talk about that a lot.
Well, let me just interrupt you there, because that seems to me that would be like a hot rail that a lot of professionals wouldn't want to go over, because that's such parenting-oriented stuff.
But it's so important.
That's just it.
It's so important. And the other thing that I like to do with teens is I like to ask them questions directly, and I will tell their parents that I want to ask them directly, because I want them to be okay with talking to health professionals in the future. And the only way that happens is with practice. And so if they can tell me what their symptoms are, if they can tell me what's going on, I'd like to hear it from them and not from their parents.
You know, it's interesting because, as you say, it's important to have a health care provider because of the baselines that you get on people's conditions, and you can track them as their conditions change and all of that. But I mean, it's all you've added another dimension in terms of information and context for young people. Like you said, you're even helping prep them to be better patients in the future, thus ensuring better health outcomes. Bam! That makes you amazing.
I don't know if it makes me amazing, but what I strive to do every time I see a patient is to develop a relationship with them, because that relationship allows me to have a good, trusting, and safe environment for them to come and tell me about the problems that they have, and that they know that it's a safe space for them to talk. And you can't do that unless you establish that relationship, and so relationships are important to me.
That's fantastic. I would agree with you 100%. That coming, there's usually, when you go to see a doctor, at least in my case, especially with all the rejections, just kidding, having a relationship where it's like you can relax and just really talk about what it is because some things are a little awkward, some types of medical things you don't necessarily talk about, but you need to, and then you need to, I guess what I'm trying to say is you are providing for patients a sense of personal responsibility with their health, by the advice that you give, by the coaching they get in terms, if you will, of speaking up for themselves. All of that is developing a healthy, responsible individual who will have a better, healthier life because of the interactions with someone like yourself.
Yeah, I feel like my job...
That makes you amazing.
I don't know about that. God is amazing. I am not. But I think the most important thing for me is that when we're teaching all patients about the problems that they have and educating them and helping them to make good choices based on the research that we have, the evidence-based research that we have for them to be able to make good decisions. And sometimes, I'll be honest, patients don't always make the decision that I would make, but I still support them in whatever they do, and trying to help them have the best outcome ever.
So how do people get on your, gosh, I've got the greatest family nurse practitioner list ever? How do they come see where you were located, and what's the process?
It's just a phone call. I'm just a phone call away. So I'm working at Astria in it's
Union Gap.
Union Gap.
Union Gap.
Adam Ridge Drive.
Yeah.
Okay.
And so I'm there 40 hours a week. So.
What do you do for fun?
I do a lot of things for fun. I love driving. I love being outdoors. I love water. Just the waves and hearing it is peaceful to me.
Yeah.
So.
Great. Kimberly Sales, you are amazing. We've already established that. And you are someone that people, you still taking new patients? Because my wife's been looking for a general practitioner type person, a family medicine type person. And boy, I would have absolutely no qualms about saying you need to meet Kimberly. She's amazing.
Mm-hmm. I've been a nurse practitioner for over 20 years. And the thing that I like about being a family nurse practitioner is being able to take care of families. So I have patients that I've started seeing when they were 3 hours old or 3 days old, and was still seeing them and able to even be invited to their high school graduations. I just had a patient that I used to see on the other side of the mountain who was going to be in Ellensburg, who actually drove down to Yakima just so he could say hi. So it was pretty cool.
That's those relationships.
There you go.
That you're talking about.
There you go.
You establish them, and you become a trusted member of the family. Just happen to be a little smarter maybe than the rest of us. Especially if you know my family. Kimberly, delightful to get to visit with you this morning.
Thank you so much.
I like your approach. I think, like I said, I would be proud to suggest my wife come see you. Again, just one of an ongoing collective of great, not just great medical people, but great people that Astria has been bringing to our door with this house call program that we're doing by getting the doctors out and into our little waiting room here, if you will, as opposed to yours. And it's been really enjoyable. I think that a lot of folks have found new potential relationships and friends with all of the various specialists, Jill, that you've been bringing to us. And I'm putting you right up at the top of the list, Kimberly. So
thank you very much.
Yeah, thanks for your time this morning. Appreciate it. Have a great day.